Hi everyone. For today's lecture, we're going to go over the problems related to male reproductive system. To start with, when we talk about disorders in the male reproductive system, we refer to disorders that involve the urinary system and reproductive system. So remember, it's a very sensitive topic, and it involves patients might have anxiety with that, some embarrassment, especially when it's regarding issues affecting sexuality and genitalia. Oftentimes, patients do not disclose these problems and will have to seek it out of them. It is important as nurses to recognize this in order to raise awareness and provide education and support to our patients. Now, before I proceed, I would like to go over a few details regarding main structures in the male reproductive tract. So main structure include external genitalia that include the testis, epididymis, scrotum, and penis. So the most important reproductive structure is the testis. It has dual role, a role in sperm production and a role in testosterone secretion. The testes are encased within the scrotum by the scrotum, and the scrotum basically keeps the testis at a lower temperature than the rest of the body. So, to remind you, sperm travels out of the testis to the epididymis through the long vas deferens and will connect to what we call seminal glands. Those seminal glands produce the semen, which is the fluid that mixes it with the sperm. The semen travel through the prostate glands and out to the penis. Let us learn a little bit more about the testis. So within the testis, you have a very structured, brilliantly organized tubules. These are called seminiferous tubules. It is within these tubules that sperm is synthesized. The seminiferous tubules connect to an area that's called rete testis, and then it connects to the epididymis. And remember, the epididymis is the one that stores the sperm that is produced by these seminiferous tubules. Then the tail of the epididymis will connect to the vas deferens, etc. So as you could see that urine and semen pass and exit through the same place, of course, the penis, and but you need to know that these two processes do not happen simultaneously. So, for example, when you urinate, the ejaculatory ducts will close, and vice versa. When you ejaculate, the urinary bladder sphincter will close. Okay, so a few things I would like to talk about, some gerontologic considerations. So what happens when someone in the greater than 65 years of age, you would expect the prostate gland to enlarge a little bit. There is a decrease in the prostate secretion. The testis decrease in weight, becomes softer, atrophy, and there is a decrease in plasma testosterone level. There is some decrease in sexual function, maybe decrease in sexual desire, maybe slower sexual response, longer time for sexual arousal. When men exceed 50 years of age, they are at risk of a variety of GU cancer, genitourinary cancers, mainly kidney, bladder, penis, and prostate. And here comes the importance of preventive testing, such as doing the digital rectal examination, and it is recommended after 50 years of age. However, those who have a strong family history of prostate cancer, then they recommend to start the digital rectal examination at the age of 45. Also, PSA, prostate-specific antigen to screen for prostate cancer, is done. Urinalysis to look for kidney function and screen for hematuria. So when it comes to the assessment of the genitourinary tract, we're going to ask about the sexual function in general and about the urinary function. When it comes to the sexual function, make sure you are careful about the variety of social factors, the cultural, the religious, and personal preferences that dominate here. So you really would want to be wise about how to approach an individual with questions regarding to their sexual health. And I believe the next slide kind of give you list a model that we could use in order to do such assessment. When we are doing an assessment for the urinary function, you want to check for symptoms of urinary obstruction. So, for example, you would ask a patient, do you have to use the bathroom often? Do you do what we call double or triple voiding? You have to go 2 to 3 times in order to empty the bladder. Do you wake up to urinate at night? Do you have pain upon urination? Any blood in the urine? Remember, today we discussed painless hematuria as one of the main sign and symptom of bladder cancer. Hematospermia, decrease in the force of stream. And then, of course, you will be asking about drugs that may have some impact about sexual function in general. So if we recall from the cardiac lecture, beta blockers tend to have major impact on sexual function. Sometimes alcohol use have a negative effect as well. And the presence of medical morbidities such as diabetes and cardiac diseases. So when we as nurses start with the assessment of sexual function, you're basically indirectly providing a safe environment to discuss valid sexual concerns. So there are several models that are created that help us as nurses address issues with sexual problems with patients. So the P is the permission. Basically, you would start by asking permission to discuss sexual functioning. And once they give you that permission, then you would go ahead and start your assessment. And the model continues where you have limited information. And basically, you are getting some information from the patient regarding sexual function, which basically leads to specific suggestion. That discussion progresses where the nurse now would provide specific suggestion regarding intervention regarding those sexual concerns. And the last thing, which is the intensive therapy, is reserved to these to those specialized in this area, such as sex therapy and those individuals. So physical assessment. Under this topic, we're going to talk about digital rectal examination. This is something that is done routinely for men greater than 50 years of age to screen for prostate cancer. Now remember, those who are at high risk to get prostate cancer, those with family history, African American men, the recommendation is to start an annual DRE, digital rectal examination, at the age of 45. Remember, this is an uncomfortable procedure. It's not fun, patients dread this type of exam because it is painful somehow, and it involves using your finger, that, of course, gloved finger that has to be lubricated and placed in the rectum, and the goal of that is to assess the size, the symmetry, the shape, the consistency of the bladder. So we're looking for tenderness upon palpation. We're looking for the presence of nodules. The way we position patients, a couple ways. They could be leaning forward on the examination table or lying on their side with their hip flexed toward the abdomen. And one technique we use in order to eliminate or minimize, let us say, the discomfort, you could ask them to take a deep breath and exhale slowly. That will relax the anal sphincter as the provider is inserting his or her finger. Will not be as uncomfortable if they don't do this technique. Another physical examination that is done is testicular examination. And basically with this, we are palpating the scrotum for the presence of nodules, any masses, any inflammation. We're looking to see any ulcerations around the penis, any nodules, inflammation, discharge, or palpating the penis and the scrotum. For those men who are uncircumcised, we're expected to retract the foreskin and do that same examination technique. And when you're doing the testicular examination, you are providing an excellent opportunity to teach those men to do their own testicular self-examination and to remind you that has to start from adolescence. Okay, so what are the diagnostic tests we use? Several. PSA, I'm sure you've heard of it. It is a test that we recommend for men greater than 50 years of age. So a PSA, prostate-specific antigen, is a protein that is produced by the prostate gland. Now, remember, this is not a specific test for cancer. So if you have an elevated PSA, it is indicative, it is sensitive for problem, but it's not specific for cancer. So high level could be cancer, or could be BPH, benign prostatic hyperplasia, or could be inflammation of the prostate, prostatitis. So really not specific by any means. It is sensitive for detecting the problem. Now, you do PSA test. It is elevator. You did the DRE, the digital rectal examination. You find abnormalities. Then the next would be direct visualization using ultrasonography, transrectal ultrasound. With that, many times, if you see a mass cancer, it is accompanied by getting a biopsy. So you would do ultrasound guided needle biopsy of the prostate. And the third point here, the prostate fluid or tissue analysis, that is done when you're doing the transrectal ultrasound. You would take around 6 to 12 biopsies, and we have 4 different zones in the prostate we look at, medial, lateral, etc. So you take 6 to 12 biopsies in total and send them to the pathology lab. We will now talk about disorders in the male sexual function, and I'll start with erectile dysfunction, also called impotence. And basically, this means that there is a decrease in the frequency of erections or an inability to maintain or achieve a firm erection. Around 30 million men have this condition in the US. Around half of men between 40 to 70 years of age will have some kind of of erectile dysfunction. It has psychogenic or organic causes. So when we say psychogenic causes, we are referring to anxiety, fatigue, depression, certain pressure to perform sexually, absence of desire in general. And when we are talking about organic causes, now we are referring to maybe diabetes, kidney disease, cardiovascular diseases, hyperthyroidism, neurological problems such as neuropathies, drug abuse, and medications. So what are the medications associated with erectile dysfunction? Remember, clonidine, hydralazine, beta